Welcome to Ask Syd, the official podcast for Sydenham Clinic, a clinic where luxury meets medicine. We are on a quest for longevity. And I am so thrilled to be your host on this show. My name is Anchal Bhatia. I am the founder and CEO of Sydenham Clinic and the author of Your Doctor Is Not God and How to Be the CEO of Your Health. I look forward to taking this journey with all of you and having amazing thought leaders, guests, and members of our Sydenham team answering questions that you put forward. And I urge you, and I hope you will, ask Syd more questions on longevity, wellness, living to your highest potential. We are all trying to be the best versions of ourselves. And our physical, emotional, and mental health is foundational for us to achieve health and success in other realms of our life. So welcome to Ask Syd. Welcome back to Ask Syd. And today's topic is cosmetic surgery. Well, it sounds vain, but we're not going to go into really the details of cosmetic surgery and start recommending it to you all. But there is an important reason why people get cosmetic surgery, which is to make us feel good. So last year, there were about 500,000 breast augmentation surgeries done, and that by far is the most popular cosmetic surgery out there. So why do women really want to augment their breasts? Well, 93% women said that increases their self-esteem. 73% women said it makes them feel like a whole person. So today, we're going to talk about breast augmentation, breast surgery, and more with Dr. Kriti Mohan. Dr. Kriti Mohan is one of the finest breast surgeons, plastic surgeons in Houston, and we absolutely love her work. She has a huge Instagram following. She's quite the local celebrity in town. We are really going to have some fun. And we will really go down to the basics because a lot of times, you feel that breast surgery is not for you, so you don't know enough. But you could have a sister, you could have a daughter, or you may have thought about it at some point in your life. But we just want to understand, what do women come to you and tell you? Like, what's the starting point?
Yeah, I think you said it perfectly correctly, is for most women, it comes down to really how they feel and not how they look. And I think breasts are kind of a defining part of that sexuality or femininity in a way. For most women that come to me, whether they're younger or they're older, whatever age group, it's really about regaining a sense of self. The common thing that I hear consistently from women is, I just want to feel comfortable in clothing. I want to feel comfortable in my own skin. So whatever the reason is, maybe it's childbearing, maybe it's weight loss, it's the same story over and over again. And that's their main focus.
So do most people come to you to increase their breast size, or is it to change the shape or decrease it? What is the most common?
Yeah, so as you said, breast augmentation is by and far one of the most popular of all plastic surgery procedures. It's not far above, however, breast reduction. I'm known as the breast doc, so I see all things breast, but I will say that probably over 80% of my practice is implant-based, so enhancements, augmentations, and exchanges, and then there's a subset, of which I'll do reductions for, and that just happens to be my practice. But so I think in the current world that we live in, a lot of augmentation happens just because women lose a lot of volume in their breasts with, children and childbearing too.
And what ages, typically do you see, and what's the oldest patient you've ever had?
Yeah, so I personally don't operate on young women under the age of 18. I think that they should be able to consent for their own procedures as an adult. There are, people that do surgeries on them younger than that. With breast reductions, I actually will see patients younger. Like, I'll even do a breast reduction on a 14-year-old or a 15-year-old because these poor girls have massive breasts. Genetically, they're just crippled, and it really affects their entire lifestyle, their self-esteem. They can't exercise, they can't wear clothing, they're teased in school. So it's actually the American Society Board's recommendation that it's safe to operate on these girls if their breasts are stable. So I will operate on those women younger. But then, I operate on women much later into life. We're living longer and longer. I had a patient that consulted literally 2 days ago, and she was 73. She's never had a breast surgery. She's extremely healthy. She's lost a ton of weight, and she is finally done, raising her whole family, kids and grandkids, and she wants to feel good about herself.
And you're going to do it at 73?
Yeah, I asked for cardiac clearance. I had to talk to all her doctors, and so we just met. And she's going to get me all of this. But, this is a woman in front of me who's probably healthier than some 40-year-old women walking around. She's not on any medications. She can walk up 3 flights of stairs. So, if she's safe from an anesthetic standpoint, she should get to do, what she wants to do if it's safe, yeah.
Absolutely, because, our whole focus here at Sydenham Clinic is longevity. Most of our members are healthy, they're usually fit, they're into biohacking, they're quite conscious, they live conscious lifestyles.
Yeah.
So once you start feeling good on the inside, you want to feel good on the outside, or it could be vice versa. Sometimes you feel good on the outside and you want to feel good on the inside. It motivates. I think they're both related.
I agree.
And a lot of people view cosmetic surgery as a vanity procedure.
Yeah.
And today's purpose really is to demystify that and to that's a myth. It's not a vanity procedure. It could have more depth and it can be life-changing.
100%. So speaking of that, breast reduction that we talked about is actually the highest satisfaction procedure in all of cosmetic surgery. So all told, you can take all the hundreds of plastic surgeries that you can have. Breast reduction, highest satisfaction because it immediately changes a person's quality of life. And they've studied this on happiness scales, depression scales. They've studied it on their activity exercise level. So they've rated all of this and they've actually proven that it's statistically significant.
So it's a mental health procedure.
Truly. In fact, it's actually covered by insurance. Breast reduction is, and so it actually is shown to do that.
Right.
Yeah.
So can we dive into the basics of what really is breast augmentation? What happens? Should we be scared of it? Does it cause cancer? Some of the, there's a lot of misinformation out there and there's an unknown, and people tend to be, at least the culture that we come from, are embarrassed, they're shy to ask questions, they don't know enough. And there could be a lot of physicians out there who could misguide you.
Yes,
so, that is the goal, for people to be empowered with information so that they make the right choices and right decisions.
Yes. Dr. Google is not to be trusted.
Dangerous.
So I always tell patients, do your own research, but then verify it with, a board certified plastic surgeon. I think gone are the days of Dolly Parton, I love her, but of extreme enhancements, of really drastic changes. It is out there, but I think nowadays a much more subtle, natural enhancement is actually much more popular than we think, because when you're looking at people walking around and they just look great, we don't think, oh, you had plastic surgery, right?
Because you want to look natural.
Yeah, and the truth is probably most of those people have. And nowadays, with breast implants, there's so many different varieties. You can have such smaller implants with natural look and natural feel.
So what are these? Now we're curious,
So we've got, so all of these are silicone implants.
Okay.
So implants have been around for decades and decades, since, they were invented in the 60s, and so we've had multiple iterations of these. We're on, 5th generation implants that are still changing now. And
are these all the
silicone?
same?
These are all
these
silicone.
Are heavy.
Gummy bear implants.
Does the whole thing go in?
Oh yeah. One
That's heavy.
Yeah, they're actually not. So people always ask that, but if you actually weigh this, so if you're holding a 375 cc implant, that's 375 grams. So if I were to put 2 of those in you, we wouldn't even be talking about a pound.
You put 2 of these?
Yeah.
In people?
Maybe not that size.